Jen Covich Bordenick. I'm the CEO of the eHealth Initiative, and I want to thank you today to our executive and welcome you to our Executive Insight series. This is a brief series we kicked off last month where we're featuring different executives from around the industry to talk to us about what they're doing right now during the COVID-19 period. And we've got a sensational executive with us here today who we're going to be just doing, I guess, an informal back and forth with. So if we go to the next slide, Claudia, we've got a couple of quick housekeeping items that I just want to run through quickly. Everybody's muted, as you know, this is the usual. If you want to ask questions, we've gotten a lot of your questions in advance, but if something comes up that Lisa mentions and you want to just ask a follow-up question, go ahead and put it in that Q&A down at the bottom. There's a Q&A box, and let us know what your question is, and we will try to get to it. And then we're going to have a recording of today's presentation. So after you see what happens today and you want to spread it to all your friends, feel welcome. Claudia will send out a note tomorrow with a link to the presentation today and share it with as many people as you like. We're happy to spread the wealth. So next slide, Claudia. So for those of you who don't know, eHealth Initiative is a small nonprofit that convenes executives who are transforming healthcare through tech and innovation. And we've been doing a lot of that recently. If you go to the next slide. This is just a sampling of some of the organizations that eHealth Initiative and the foundation works with around the country. As you can see, providers, payers, labs, patient advocacy groups, a lot of vendors, researchers, universities, everybody who's really working on healthcare and technology right now. Next slide. And these are the different areas of focus that we work on. Generally, transparency, interoperability, privacy, analytics, and yes, you will get a copy of these slides tomorrow. For the people who are already chatting in here, we will send you a copy of these slides. Next slide, Claudia. We've been focused a lot recently on how do all of those areas relate to COVID-19, and launched a COVID-19 webinar series, in which we've already held about 8 or 9 different webinars in the last 2 months, 2.5 months at this point. And they're all available online at eidc.org, where you can listen to them again or get the materials. Coming up, we've got Lisa today, and next week we have Len Lichtenfeld from American Cancer Society, who's going to be talking to us about cancer patients. And we've got a really fabulous webinar coming up on the 28th on contact tracing and patient matching. So that's going to be exciting as well on May 28th. And a number of other things that just aren't on the schedule yet. So stay tuned. If you have something that you haven't heard us talk about, we'd love to hear from you. So email Amy at eidc.org, and let's talk about what we can do to teach other people about what you're doing in the field right now around COVID-19. We're trying to share the wealth here and let everybody know what's working and what's not working. So this is really about lessons learned. So as I mentioned, I'm really excited to have Lisa here. So we've known Lisa for a number of years, actually. Dr. Leeside, who is the Chief Medical Officer at Zypnosis since 2016, where she started as Medical Director and was appointed to Chief Medical Officer in 2018. She's really an incredible member of the team, really involved in working with the health systems and clinical needs, and working with all the clinical leaders that Zypnosis works with. She's a practicing physician for more than 25 years, board certified in occupational medicine. And she actually did residencies in both occupational health and emergency medicine, which I'm sure comes in very handy right now. You probably have a lot of thoughts about what's going on right now in ERs. Graduated from Yale School of Medicine, and actually still works now, I guess. She treats patients at the Center for Victims of Torture, which sounds really interesting. Love to hear a little bit about that. And we're just delighted that she's here today. So she's really got a passion, I think, for digital health, and you'll see she's got a wealth of experience she can share with us. So really interested in your perspective. So welcome, Lisa.
Thank you, Jen. Very happy to be here.
We're glad to have you here. So why don't we just start by give us some of your perspective. So, Zypnosis does a lot in telehealth, and why don't you tell us a little bit, maybe just give us kind of the quick spiel about Zypnosis so people who don't know what Zypnosis is can understand what you guys do.
Sure. I'd love to start with a little bit of background on Zypnosis, which was started about a decade ago to give an alternative to traditional healthcare. So consumers in all of their experiences, banking, grocery shopping, retail, are starting to demand more, and they're expecting those changes in health as well. So when we started about a decade ago, we wanted make healthcare more patient-friendly and more efficient. So we have a software platform for health systems where we offer virtual care, which gives patients choice and convenience, gives increased efficiency to providers and high-quality care. We currently power the virtual triage and virtual visits in 4 different modes of care. So that's asynchronously through our intelligent interview, through chat, through phone, and through video in over 50 health systems all across the country. So we started with virtual visits for urgent care and have expanded to primary care, behavioral health, postoperative care, occupational medicine, and it really can be applied to any healthcare specialty.
So, I mean, I think it seems like all of those different areas you just mentioned, primary care, are now kind of being forced into this virtual care because of the pandemic, which has actually been, I think, a great thing, because a lot of groups that maybe wouldn't have done telehealth before are now doing it. What do you think in terms of, what have you seen on the patient side? So do you think patients were initially kind of hesitant about telehealth? I'm just kind of curious about your thoughts about patients and their perspective about telehealth, and if you've seen that evolve at all.
So over the years, I think there's been a pretty slow uptake of telemedicine. Those of us a little more close to the business probably thought it would be faster as an uptake. Patients are used to the old way of doing things, and more importantly, providers are used to the traditional way of doing things. And also the regulatory rules and reimbursement was sort of geared towards traditional healthcare. What we're seeing now with the pandemic is an absolute switch to a dependence and reliance and appreciation for telemedicine. And I can tell you a little bit about our numbers and how that has changed dramatically with the pandemic. I think if there is a silver lining to the tragedy of this pandemic, it may be a greater uptake of telemedicine, which translates into a far more efficient way of caring for patients across the continuum of healthcare. So just as a brief glimpse of some of our numbers, in the first few weeks of the COVID-19 outbreak early in March, we started to see a 3,600% increase in overall platform utilization. So just for some perspective, in March alone, across the platform, we had 674,000 patient interactions, with volumes on one day surging as high as 38,700 virtual visits. That was just in one day. So since then, we've seen an increase in virtual care unrelated to COVID, which makes sense given the social distancing that we have and people need to continue getting healthcare. So I think some of those numbers show how this particular situation shows how patients and providers can move to virtual care, not just to treat COVID-19, but to treat a multitude of conditions.
Wow. And what do you think about, you mentioned it was harder to get kind of the providers on board prior to the pandemic. I mean, what do you think has changed about kind of their perspective about using telehealth as a vehicle for delivering care?
So it's been really interesting to follow that in the last 6 weeks or so. I've been reading some accounts of doctors who were used to the old way of calling patients in for med checks or repeat visits, and with the dangers of bringing patients in for in-person care right now under COVID and with our social distancing guidelines in place, they've been able to look through their patient visits for a day and realize that some of these patients can be taken care of with phone calls, some with video calls, and some with asynchronous visits. So I think it's provided a real opportunity for providers to try and look at how they can most efficiently take care of their patients safely in this pandemic. And I would suspect, if we get into making predictions, that some of those changes will last long post-pandemic as well.
Yeah. Well, I mean, one of the great things about, not the great things, but silver lining about the pandemic, I think, has been the reimbursement policy that's really changed. And you alluded to early before there was kind of it was much more difficult to get payment. Can you talk a little bit for folks that don't know about how the reimbursement structure has changed in the last 8 weeks?
Yes, so immediately on the point in March where it became clear that the pandemic was going to be very serious across the country, CMS and insurers made changes in the regulatory or reimbursement for capabilities for telemedicine. So right now, it's potentially temporary. The reimbursement landscape has completely changed, and telemedicine visits are reimbursed. Moreover, some of the regulatory changes, so some of the state-based licensure are temporarily suspended. So providers in one state can currently treat providers in another state. Some of the CMS requirements about where a patient needed to be in order to get care have also changed. And all of those are fabulous changes for the pandemic to help patients get care wherever they are from providers who are able to care for them. And frankly, I hope they last post-pandemic as well.
Yeah, and we've spoken with a lot of executives over the last several weeks and providers who are really concerned that CMS after the pandemic, which God willing will end in the next 12 months, might revert back or go backwards. And I think we're all hoping that CMS keeps a lot of these in place, because it's been very positive, I think, for patients to be able to get care in this way.
I agree. I think it's been very positive. I think I might quote someone from CMS, perhaps it was Seema Verma, who said, "The genie's out of the bottle." And I don't know that we can go backwards. Patients will expect this. There are, in many ways, it's a far superior way of giving care in certain situations. And I think we'd be foolish to ignore some of the useful learnings from this pandemic.
Yeah. One of the things we've also learned, I think, over the last several weeks is there are different ways to implement telehealth solutions. Can you share with the group, some of the best practices around telehealth? We've heard from different providers about benefits of having kind of a waiting room or someone to help you on the front end, or just some, in terms of a primary care visit, a planned visit. Can you share kind of some best practices about what that looks like in an ideal situation?
Sure. So one thing I would stress is I think telemedicine should be provided along the whole continuum of care. So there are some conditions for which an asynchronous visit with an intelligent interview is exactly what you need, and that's enough. There are other conditions where you might start with an intelligent interview, and in our platform, we're able to shift between modes of care as appropriate, either by the software conditions or by the provider. But sometimes you might start with that intelligent interview, which will group all of your answers, will be sure that all the correct questions are asked, but then the provider might need to step up for a chat, a phone, or video, an extra touch point. And then along the continuum of care, it may be that someone needs to be referred in for a lab test, which we can do through our technology, our zip ticket technology, or come in person. And that whole spectrum of care should be done just at the right level for what people need. And I think as you set up your telehealth practice to think about the continuum of care and how you want to be able to triage people in person when they need to be seen in person, or step them up to a more elevated mode of care if needed, to think about some of those long-term concerns, not just for the immediate need of COVID, but as you set up your telehealth platform to be planning some long-term solutions as well.
Yeah. Can you talk a little bit about, do you think that, is there anything you can do to kind of help providers implement telehealth? Do you guys offer anything? Are there guidelines or some place where, clinicians who are trying to figure out how to do this can go to learn how to do this better? So for your provider who's like, okay, I've got to do telehealth now. I've got the software, I've got whatever. What do you tell people?
There are some best practices out there, and the ATA, or American Telemedicine Association, is a great resource on some of those practices. One thing I would stress, telemedicine is a different a mode of giving care, but it's still the same care. You're still got the same medical knowledge, the same connection with your patient. You're just using a different tool. And I think for a long time, providers have been calling patients on the phone, or now getting used to sending e-messages. And it's the part of the way you communicate with patients that you're not starting from scratch. So I don't think providers should be intimidated by communicating over telemedicine with their patients. same practice guidelines apply. There are certain tools that will make it easier if your telemedicine platform has clinical decision logic built into it, such as ours does, or quality measures that you can measure, such as ours does. That will make it easier. But I think in general, providers should not be intimidated. It's another way of communicating with their patients, and that's what providers do.
You mentioned earlier that, again, I think there's this whole shift that we're witnessing in front of our eyes right now, going from in-person services to telehealth services. Is there any data or research kind of comparing the effectiveness or satisfaction of patients with telehealth, or prior to the pandemic, anything we know about the two alternative ways of delivering care?
We do know there probably hasn't been as much research as we like, but I can tell you about a couple of the studies that we have done. We measure our adherence to antibiotic prescribing based on evidence-based guidelines, and we're able to compare our providers across the country who prescribe antibiotics on our platform, generally over 90% in agreement with evidence-based guidelines. When we compare that to in-person prescribing, we found it's a little hard to compare, but studies that range from in the 50s to 70% adherence with evidence-based guidelines. So for us, that shows that when you bake in clinical decision logic to some of the visits, you can get better adherence with evidence-based guidelines. And we're just about to present another study at the ATA conference in June, looking at prescribing by time of day, which has been a really interesting concept out pre-pandemic, that in general, antibiotic prescribing as well as referrals for preventive care and opioid prescribing vary by time of day with providers. So typically, in the studies that we've seen in the last couple of years, prescribing or referring to cancer preventive services, for example, the highest rates will be patients who were seen early in the morning by their provider, and late in the day, those numbers will drop kind of dramatically. Same with antibiotic prescribing. We did a study this last year looking at antibiotic prescribing by time of day on our platform, and found that given the clinical decision logic that's baked in, our prescribing by time of day does not vary. Our high adherence to evidence-based guideline is the same. So there's a couple examples.
Is that data that you're collecting right now, or is it data that was collected before the pandemic?
So on our antibiotic prescribing was a study that we did pre-pandemic.
Yeah. Are you?
Yep, it's pre-pandemic.
Are you collecting data now during the pandemic, or do you know of any researchers who are? I'm just curious. It'd be interesting to see.
So I think there's so much. We are collecting a lot of data right now from the pandemic. Have not yet had a chance to analyze it. We do have some of our health system partners, some academic health system partners that are really doing a great job of using AI and natural language processing on our visits to link terms and symptoms with the test results that they're getting for COVID. So I think some of that will be coming out pretty soon, but there has indeed been a fair bit of research going on.
What about changes that are kind of being made to digital health? So not just telehealth, but do you think this is having an impact on other types of digital health, like remote monitoring, wearable? I'm just curious if you think this will kind of roll over into other areas of delivering e-health.
I do. I absolutely think remote monitoring will increase due to the pandemic, and likely stay in, just as I think digital health solutions in general will be more used. I think this pandemic will open us up to the possibilities of letting people get more care at home, not just during social distancing, but I've been reading articles. There's so many articles where the title is OBGYN care will never revert to as many in-person visits, and multiple specialties like that, where I think we will be able to do more care in the home.
Are there any specialties that you think are lagging a little behind, or could benefit more from using this right now, that are maybe more hesitant than others? Or
for specialties, that's a good question. I really think any specialty can can benefit from telehealth and telemedicine. I think we're going to see a big uptake in occupational medicine with telemedicine, particularly with healthcare worker and first responder safety, that the capabilities for digital health, for testing their safety, for testing healthcare worker contacts. I think there's a lot of opportunity in occupational medicine. And this pandemic may put forward. That may be one area that has been perhaps lagging a little bit, but with the importance of our first responders and healthcare workers and these really great digital tools to monitor them and watch for their safety, I think that will be an area to watch.
What's kind of your best guess in terms of the number of patients that you think will kind of adopt this as their go-to mode of medicine moving forward? I mean, patients are certainly getting used to it, but are you thinking after this, you know, maybe about half of patients will prefer this to going in person? Do you think it's just kind of a temporary?
So I don't know if I have an exact percentage to give you, Jen, but I certainly don't think it's temporary. I would like to envision a future where everything starts digital to start with, and then you get routed to the right level of care. So that you can start through a digital front door and get your initial questions answered and see if immediately you have an emergency condition and need to go in, or can you start with an asynchronous, perhaps step up to phone, video, or chat, or do you need to come in? So I think it will be a significant % of visits that will start like that.
If you had kind of an algorithm, and I would imagine, you know, clinicians have a very methodical line of thinking about which types of patients are best suited for telehealth and which are definitely kind of outside the realm. Where do you draw those lines?
So I think any patient can be suitable for telehealth, certainly to with. It may be more of what they actually need to get done in their visit. So you may start with a telehealth visit, but because you need a biopsy for a dermatology condition or a lab test, you may need to come in. I think when we started our platform, we thought perhaps it was best suited for 20 to 40-year-olds, for example, with comfort with digital platforms in general. And certainly we have a majority of our patients that are in that age range, but I've been amazed and impressed by patients of all ages up into the 90s that have been able to interact with telehealth as needed. And in this pandemic, those are patients we want to keep at home and keep safe. So the more we can make it easy for them and seamless to do this kind of care, the better.
And do you see any movement towards providing patients with, you know, because it feels like right now, if you need a lab test, you've got to come in the office. If you need any kind of, I don't know, I'm not a clinician, but, you know, a blood pressure taken, or you need a shot, or you need, you know, a swab taken, you have to come in the office. Is there any possibility those things could be offered at home as well?
So I think eventually we will get to home testing, and we will certainly get to the remote monitoring and blood pressure and things like that. One of our products we have is called Zip Ticket in our list of zippy names at Zypnosis. And the Zip Ticket is a way where we were able to merge the online visit with the brick and mortar visit. So if you do a visit for strep test, for example, in one of our health systems that has the Zip Ticket strep, it's an evidence-based guideline requirement to get a strep test in order to treat strep. And so we're able to do the intelligent interview and then send a patient directly to the lab with a fast pass, like a boarding pass, to get the lab test in a very convenient way without an extra visit. So they do a walk-in visit for that lab. We expect at some point to have home testing for COVID, where we can ship that out or have you pick up a home test for COVID, for example, to see if you're safe to return to work as one use case for that. So I think there will be more and more where you don't need to come in. I think biopsies, you'll still need to come in, a physical exam to palpate a mass, certainly a procedure. But that's part of that continuum of care where we should be doing just the right amount at each level and not requiring people to come in for a simple med refill, for example, or to start birth control pills. Everything should be done at the right level of care.
Mm-hmm. We've got a couple questions here I want to try to get to. So one participant is asking about liability insurance. Does that have to be modified for clinicians to start doing telehealth? Is there additional liability?
Typically it does not, but that's a question for each provider to have with their malpractice carrier. Most malpractice carriers now are including telemedicine within the general sphere of practice, but each provider should certainly check that on their own.
And what about, someone is asking, do you really think the reimbursement is going to be well matched to the time spent?
That's a prediction I probably won't take a firm vote on. I would like to see appropriate reimbursement for the decision-making process that's involved, and I would hope that we get there.
Okay. Are you seeing, are most insurances now paying for telehealth? Do you see that kind of across the board?
We do. Right now we see that across the board. We're seeing pretty good reimbursement, particularly with COVID in this time, which is excellent. It's the best way for patients to get safe care during social distancing.
And kind of what's your best guess about whether or not that will continue in the future in some manner?
My best hope is that it will continue in some way going forward. I'd hate to predict, but I really think back to that quote by Seema Verma that the genie's out of the bottle. I don't know that patients will want to go backwards, nor providers.
And are they generally paying at kind of the same rate as an in-person rate, or are these reduced rates sometimes?
So I believe right now we have parity, but don't quote me on that.
There's always an exception, and someone will be sure to point it out, I'm sure. What about patient satisfaction? Any thoughts on that?
Typically, we see great patient satisfaction with digital health, in part because patients have been able to avoid driving, parking, getting day work, and get their care with high quality and rapid response. So typically, we see a lot of patient action with telemedicine. We survey our patients, and we always get great comments and feedback and NPS scores as well.
Okay. We have we always get this question, because I guess this happens in a lot of practices where a provider starts a visit as a telehealth visit, and then something goes wrong and it ends up as an audio visit. So we keep getting this question of, I mean, is that happening? It must be happening a lot, because someone asks at every webinar. Is that something that you're seeing, and then are clinicians able to get reimbursed for that type of thing? Is it, how are these technical issues? Because I imagine technical issues come up in telehealth and virtual visits quite often. How do you deal with that, and does it impact reimbursement at all? And what are ways that clinicians deal with these technical issues? Is there a help desk, or how does that work?
That probably depends on what platform you're using. We certainly have customer support and help and on our platform. Our platform is geared to switch between modes as needed. So I think you were referring to that it may be possible that there's a video call going on and then something is dropped and you can finish it with a phone. And our platform, we can switch between modes of care, and a provider is perfectly able to finish that particular visit by phone, sending the same messaging to the patients if that happens. That does happen sometimes. The internet connectivity is not perfect. Sure. So I think the more mode at your disposal, the better.
And how ironic, because your video just glitched when you said that.
Okay. All right. Hopefully it's okay now.
It's fine now, but it's always ironic. So anyway, someone's brought up another question about, we mentioned earlier about being able to kind of collect data or experiences. So right now we've got all this wonderful telemedicine going on. How do we actually capture the positive experiences of this? Do you think that, NIH or ARC or somebody should be funding research around this to kind of advance this? What are your thoughts about that?
It's a great idea. I love that. I love the idea of having some kind of a coordinated national response to see how this is working. I'm not sure under whose jurisdiction that would fall. We are certainly doing our part as a company to have the data about quality, efficiency, patient satisfaction, provider satisfaction, and I suspect a lot of other companies are doing that as well. But a coordinated response, whether it was from CMS, would be terrific, or under the American Telemedicine Association that's also working on that. Those would be great places for a national vision of what we're doing right now.
Okay, I'm not sure what an E&M is, but with the new 2021 physician rules for E&M visits, do you think they should be revised to include telehealth visits?
I'm not 100% sure of the specifics of that question, but I think the answer is still yes.
Okay.
We should be including telemedicine in every possible encounter with patients.
Okay. And of course, there are always kind of security concerns and privacy concerns. And what do you in general tell people about telehealth and security?
So right now, I think some of the more established providers like Zypnosis have very strong HIPAA and security considerations in place, high trust certified, things that we've been working on for a long time. I think there are a number of quick solutions that have sprung up for the needs of this pandemic, and I would encourage you, as you're looking at those platforms, if you're a provider, to see what their HIPAA and security compliance is. During this pandemic, some of the HIPAA and security privacy recommendations were lifted temporarily for the pandemic. We have had a long-standing HIPAA high trust certification in our company, so that's not an issue for us, but I would encourage you to look at any provider that you're using to be sure that they have adequate HIPAA and privacy setups for you.
Okay, great. Do you think that the proliferation of telehealth is going to help us get towards value-based care quicker?
That's another one where I certainly hope so. I think telehealth and particularly efficient asynchronous care is a fabulous way to get to value-based care and really provide more care for our healthcare dollars in the U.S. So I hope it does.
Are there any kind of unique integration issues or concerns about how to integrate the telehealth data with an EHR? Does that happen automatically? Are they two separate systems? How does that work?
So it doesn't happen automatically, and it is certainly possible to integrate. So our platform, we can integrate into a variety of electronic health records, and we have integrated successfully at a variety of different levels, but it does take some work to do that. On the other hand, our platform can live atop your medical record without full integration and also be fully effective.
Great. And then are there other specialties, you know, dietitians or social workers that use your telehealth services?
Oh, that's a great question. Thank you. Typically, we started with nurse practitioners, PAs, and doctors, and as we've expanded our use cases, we have indeed expanded the types of providers that can use the platform. So we have licensed mental health professionals that can use the platform, and we even have a nurse triage function that we started just for COVID. As thousands of visits were rolling into some of our healthcare systems, they asked for a nurse triage function to help triage some of those visits for the providers, where the sickest ones were able to be sent to the providers first. So we have the triage function as well, and we're able to have diabetic nurse educators or any kind of provider on the platform for particular use cases.
Great. And I know we've kind of come to the end, or we've gone over a little bit of our luncheon series, but I did want to give you kind of an opportunity to close and share some kind of final words of wisdom with folks about telehealth and your experiences. Any final parting thoughts for folks to take with them?
So to repeat what I said before, I think there will be a silver lining of COVID, and I think it will lead us to better, more efficient, higher quality healthcare at a better cost across the country. Telemedicine and digital health will certainly be a part of that, using whatever tools we can to drive towards value-based care. The asynchronous, efficient, intelligent interview will start that. So I'd like to think there's a silver lining to COVID, and after this period of social distancing, we'll end up with better healthcare than we started.
Yeah. Well, thank you. Thank you, Lisa, so much for joining us today. And thanks to everybody out there for joining us. We'll be back in about 2 weeks for another session. Hope everybody is healthy and stays healthy. And thanks for joining us today.
Jen, thanks for having me.
Great.